guys, this is Dr. Hub. Today we look at the relative as well as the attributive risk. So let's first look at the relative risk. So relative risk, in short, we are writing it as RR. It is the ratio of incidence. It is the ratio of the incidence of the diseases. The ratio of incidence of the disease or the death among the exposed to that among the non-exposed. So it is about the exposed to that of the non-exposed, and this is known as the relative risk. So this is also known as a risk ratio. It is also known as a risk ratio, that is aka also known as the risk ratio. So let's write it as a formula. So this relative risk is equal to the incidence of disease among exposed to that of the incidence among the non-exposed. So it is exposed to that of the non-exposed. This is the formula. So what are the information we gather from this? So it is a direct measure of the strength of association. So it is a direct measure, and this is of the strength of association. The strength of association. And this will be nothing but between the suspected cases, between that of the suspected cause and the effect in cohort studies, effect in the cohort studies. So in case the RR, the relative risk, is less than 1, what does it indicate? It indicates that there is inverse association. There is presence of the inverse association, that is, there is a protective effect. There is a protective effect. Then in case of RR, that is greater than 1, what do we have? In case of RR, before greater than 1, let's look at RR, that is equal to 1. So in terms of RR greater to 1, there it indicates there is no association. So there is no association. Next is in case of RR, that is greater than 1, what do we have? Greater than 1, there is nothing but there is a positive association. So less than 1, it is inverse association. Greater than 1, it is a positive association. Now let's look at RR of 2. So RR, if it is equal to of 2, it indicates that there is a 100% of increase in the risk. There is 100% increase in the risk. Next, let's look at the relative risk calculation. So how do you calculate the relative risk? So under the relative risk calculation, we need to know that RR is equal to A by A plus B divided by C by C plus D. So this is the formula. So now let's break this down. So we have exposure on one side and we have cancer on the other side, and we have yes and a no, and then here also we have a yes and a no. So these are the values, that is A, B, C, D, and then we get the respective formulae. So now we will look at the attributive risk. AA, it is nothing but the attributive risk. So attributive risk is nothing but the difference. It is the difference in the incidence. It is difference in the incidence rates or the proportions of disease, or even the death, and this is between the exposed to that of the non-exposed. This is between the exposed as well as the non-exposed and the non-exposed group. So it is expressed in percentage. It is expressed in terms of the percentage, and it gives the extent to which the disease can be attributed. So it gives the extent to which the disease it can be attributed, and it can be attributed to the exposure in case of the cohort studies, attributed to the exposure in terms of the cohort study. So let's look at A. AR, that is the attributive risk. So this is AR, that is attributive risk. It is equal to the incidence. It is equal to the incidence of the disease rate of DR. We are writing it as disease rate among the exposed, and this will be among the minus the incidence of the disease rate. This is among non-exposed. So among exposed minus that of the non-exposed, and we are dividing it by the incidence of the disease rate among the exposed. So in short, let's write it down. It's exposed minus the non-exposed divided by the exposed. So we are saying these two are similar, and this is the non-exposed. So what do? You multiply it by 100. So that's how you get the attributive risk. It is a difference in the incidence rates or proportions of diseases or death between an exposed and the non-exposed group. So this was all about the relative and attributive risk. To learn and grow daily, please do subscribe.